Typically, we do recommend that all patients come in for an annual checkup. And during these visits, we discuss the health maintenance recommendations. And this includes like colon cancer screening, screening for lung cancer if you're at risk for lung cancer, checking the blood pressure, looking at the skin for any evidence of skin cancer, promoting healthy lifestyle. And it's during these health maintenance visits when we have the chance to really talk about the risks of long-term tobacco use, including lung cancer, various types of malignancies, shortened lifespan, heart disease, stroke. Certainly, having either high blood pressure or high cholesterol increases your risk of cardiovascular disease. So it's important just to take the time, particularly during Men's Health Month, to make the call to your physician, get in and be screened. Have your blood pressure checked and have your cholesterol checked. Depending on what the blood pressure is or the cholesterol level is, your physician would then make recommendations to treatment. We routinely screen patients for diabetes with a simple blood test called a hemoglobin A1C. And if it would come back elevated, again, depending on what the level it is, we would make treatment recommendations based on that. It is very important if you are diabetic to maintain good diabetic control, because long term we know having diabetes doubles your risk of heart attack, stroke, and peripheral vascular disease, as well as chronic kidney disease, screening for aortic aneurysm. In men over age 65 to 75, if they've smoked, they should be screened. That's a simple test. That's an ultrasound that we do. And patients that have risk factors, for example, a family history of an aneurysm, or they have long time uncontrolled hypertension or high cholesterol, then we would probably screen in that age group as well. It is very important that patients take the time to focus on prevention, being weight loss, routine exercise for 30 minutes each day, about 5 days per week, coming in early, monitoring blood pressure and cholesterol, and treating it before it progresses to cause heart disease, heart failure, chronic kidney disease. As you get older, after age 50, you really need to have an annual physical. And during that physical, we check your blood counts with the CBC, your kidney function, your liver function, your electrolytes, your cholesterol panel. If you have high blood pressure or you're diabetic, then we screen for protein loss through the kidneys with a urine test that checks for a small amount of protein. Typically, I'll check a thyroid panel and a vitamin D panel as well. During the health maintenance visit, we'll also discuss what vaccines the patient has had or may need. We typically recommend a tetanus shot every 10 years. We want to make sure the patient has been vaccinated for the flu each year. That's very important that patients get an annual flu vaccine. We do recommend COVID vaccination. We also discuss, if they would want to have a hepatitis A vaccine, if that would be indicated for that patient. The most appropriate way to get this started and to become more involved in your health and focusing on prevention is to establish care with a primary care physician. Your primary care physician can do routine lab work, evaluate most concerns that you may have, and then determine if you would need treatment or you would need referred to a specialist.